yield myself 3 minutes.
Is recognized.
Mr. Speaker, I rise in strong support of H.R. 2749, the Food Safety Enhancement Act of H.R. 2009. I remind my colleagues this bill was up before us yesterday and got 280 and some votes in favor of it. It is a good piece of legislation. It is bipartisan. It will fundamentally change the way in which we ensure the safety of our food supply and protect American consumers, farmers, and business. I would note it came out of the committee in a bipartisan fashion, unanimously by voice vote. A series of food-borne disease outbreaks have laid bare unacceptable gaps in our food safety laws. And this will be the first major change in our food safety laws with regard to food and drug since 1938. In the past 2 years alone, we have witnessed issues of melamine in infant formula and in milk products. And we have seen tainted peppers from Mexico, harmful seafood and shellfish from China, and E. coli in spinach, and problems with strawberries and raspberries. Each year, in spite of the fact that we have the most careful and safe food in the world, we find that 76 million people contact a foodborne illness in the United States. According to CDC, some 5,000 die. This legislation contains significant policy solutions that will address this situation. It is largely based upon legislation I introduced last year, along with Energy Commerce Subcommittee Chairman Pallone and Stupak. We have worked for months with our Republican colleagues in bipartisan fashion on the Committee on Energy and Commerce to get this bill right. We have worked with our colleagues on Agriculture and the Ways and Means Committees to address their concerns, and I believe we have done so. In the end, we have a bill that strikes an important balance. It does not create unnecessary burdens for farmers and small businesses, but it does allow FDA to retain all its existing authority. It takes no authority from the Department of Agriculture or the Committee on Agriculture, and it gives FDA new authorities that it needs to trace and prevent food safety problems that may originate on the farm or in other sectors of the food supply chain. And we have carefully protected the farmers against intrusion by the Food and Drug Administration. I want to talk about key provisions of the bill. Under the legislation, FDA has clear authority to issue and to require manufacturers to meet strong enforceable performance standards to ensure the safety of different types of food. FDA will establish a food traceback system so that the public health officials can easily determine the source of foodborne disease outbreaks and protect farmers and producers against unwise and inadequate judgments because of lack of personnel and money. FDA is going to be required to inspect all food facilities more frequently, and the bill requires FDA to inspect the riskiest ones at least once per year. FDA will be given new authority to ensure that imported foods are safe, a source of major concern and hazard to our people. FDA will be given new tools, recall, record access, penalties to punish bad actors, and the ability to act quickly when presented with food safety emergency. FDA will get a new dedicated source of funding from a $500 million annual registration fee on food facilities to help it conduct its work of keeping America safe. And this provision and the rest of the bill are supported by American food producers. FDA will not be the only cop on the beat. Our food producers will focus also on prevention and have a well-deserved and shared responsibility between FDA and food manufacturers to keep our food supply safe. The bill will require manufacturers to implement preventive systems to stop outbreaks before they occur. All facilities will be required to conduct hazard analysis, assess potential food safety risks, and to develop plans to keep the food supply safe. Mr. Speaker, there's nothing in this bill that is overly burdened for farmers, small or big. We have worked hard, and I believe we have succeeded in protecting farms of the family size from burdens that could harm their business and their way of life. My own district has many small farms and people with whom I work closely on agricultural matters, and I believe that they will be satisfied with this legislation. It is a fact here, and I want to address the concerns that I've heard, that farmers who sell a majority of their product direct to the consumers are exempt from the fee system in this bill. Farms that sell directly to consumers, restaurants, and grocery stores will also be exempt from the traceback system. Some have expressed concern that FDA will have access to confidential farm records and make them available for distribution. This is not so. FDA is already limited in the types of records that they can access under the law, and they cannot access financial data, pricing data, personnel data, research data, or sales data other than shipment data regarding sales. I've also heard concern that FDA will have the authority to issue safety standards. I yield myself one additional minute, Mr. Chairman. Safety standards that will apply to farms and interfere with organic farming practices. I want to make it clear that that is not so. In fact, FDA is prohibited from imposing safety standards unless it determines those standards are, and I quote, reasonably necessary to minimize the risk of serious adverse health consequences or death. A very, very high standard that they have to meet. This will assure protection of the concerns of organic farmers and that they are taken into consideration before issuing standards. This is why it has the support of the distinguished chairman of the Agriculture Committee and members of that committee from both sides of the aisle. Mr. Speaker, this is a product of bipartisan cooperation. It is supported by industry. It was approved unanimously by a voice vote in the Energy and Commerce Committee. It reflects findings of more than 20 hearings into failures of our food system safety processes conducted by 5 different committees of the House over 3 years. It addresses weaknesses in the food safety system at FDA that were identified under the Bush administration and included in concerns under the current administration. It is a well-vetted, mature piece of legislation. I urge my colleagues to support H.R. 2749. It is old enough to vote. It is over 21 years old. I urge my colleagues to support this legislation. It is a good bill. It will protect the American people, the American consumers, and it will not hurt American industry, which supports this bill. I reserve the balance of my time.